Hello there, I am Testolactone, and today we are going to talk about my autobiography. First, my generic name is Testolactone. My available brand name is Teslac, and my chemical name is For therapeutic, I am classified into antineoplastic agents and hormonal. For pharmacologic, I am classified into aromatase inhibitor and antiestrogen. My pregnancy category is C. This means that it is not known whether I will be harmful to a fetus. Do not take me without talking to your doctor if you're pregnant or could become pregnant during treatment. My mechanism of action has not been properly established. However, it has been suggested that my principal action is the inhibition of aromatase activity. Estrogen acts as a growth factor for hormone-dependent breast cancer cells. Reduction of serum and tumor concentrations of estrogen inhibits tumor growth and delays disease progression. Inhibition of aromatase enzyme by me results in suppression of estrogen biosynthesis in all tissues, reducing serum concentrations of circulating estrogens, including estrone, estradiol, and estrone sulfate. As for absorption, I am well absorbed in the gastrointestinal tract. As for metabolism, I am metabolized to several derivatives in the liver, all of which preserve my lactone D-ring. As for excretion, I am excreted into the urine, along with all of these compounds. I am recommended as adjunctive therapy and palliative treatment of advanced or disseminated breast cancer in postmenopausal women, when hormonal therapy is indicated. I may also be used in women having had disseminated breast carcinoma when premenopausal in whom ovarian function has been subsequently terminated. I was found to be effective in approximately 15% of patients with advanced or disseminated mammary cancer evaluated according to the following criteria. First are those with measurable decrease in size of all demonstrable tumor masses. Second are those in whom more than 50% of non-osseous lesions decreased in size although bone lesions remain static. And lastly are those in whom more than 50% of total lesions improved, while the remainder remained static. The recommended oral dose is to evaluate my response. I should be continued for a minimum of 3 months unless there is progression of the disease. I am contraindicated in the treatment of breast cancer in men and in patients with history of hypersensitivity to me. My side effects in the integumentary system would include abnormal skin sensations and hair loss. For the muscular system, it would be aches of the legs and arms and general body discomfort. For the digestive system, it would be diarrhea, nausea, vomiting, and glossitis. For the CNS, it would be peripheral neuropathy. And lastly, for the circulatory system, it would be edema and increased blood pressure. First, the nurse should assess the patient's breast cancer before starting therapy, and regularly thereafter to monitor the drug's effectiveness. Second is to inform the patient about my name, purpose, my action, and my potential side effects to the body and to the patient. It is also important that the nurse should check his or her patient for drug allergies. It is also important that the nurse should check the client if he or she had any adverse effect to the drug. It is important to ensure the correct administration of drugs. It is important to monitor fluid and electrolyte levels, especially calcium levels. It is vital for the nurse to document properly the given administration. After medication, it is also important to evaluate the patient's response to the drug given. It is also important to evaluate the patient and the family's understanding of the drug therapy.